I've put some slides together for myself and Dr. Rao, who, as Howdy introduced, is an advisor with the Department of Biotechnology of the Ministry of Science and Technology in India, and he's a member of the Humanitarian Board. And unfortunately, he couldn't be here. So my task in the original program was to describe what now, and so I've put these slides together with a what now, but also with some special emphasis on India. As Howdy mentioned, Harvest Plus is working on biofortified crops for micronutrient malnutrition alleviation, and the sweet potato pictured here is a conventionally bred crop, one of the 7 that Harvest Plus are working on. And the idea of biofortified crops is that they can sustainably complement other vitamin A deficiencies, or in the case of provitamin A, with less cost and logistical problems than associated with interventions which need more infrastructure, and therefore hopefully better population coverage, because all the interventions work, but sometimes getting them to the people who really need them in marginalized communities is extremely difficult. So this is really a health problem. It's a health project. It seems like it's an agricultural project because it's about crops. You know, the Millennium Development Goal 4 is to reduce child mortality to 2/3 of the level, at least, of what it was in 1990. And here are the latest statistics. And you can see that the 2015 target, well, maybe it can be achieved, but of course we need to embrace all of the possible technologies to try to get there. And within India, nutrition is a very big deal. I mean, it's 1.3 billion people, and this is the organization that needs to interface to be successful. And this includes, of course, agriculture and women and child ministry and health and so on. And this is quite a challenge for any organization, because often these functions don't speak to each other too much. You know, they don't have to. But in this particular area of biofortification, they're going to need to. So what do we have to do now to be successful? And the first thing we have to do is to continue the nutritional research to demonstrate the effect on vitamin A status. As Peter's explained, that was an absolutely essential thing for us in making the event selection decision for the one transformation event to put into all the different rice varieties where vitamin A deficiency was a problem and rice was the staple food. And what we have got in Peter mentioned the 3.8 to 1, but we've got much better conversion than conventional food sources in this food matrix, which is golden rice. The adult data of 3.8 to 1 has been published. There are even better results coming from China, which maybe Rob will, from children in China, maybe Rob Russell, who's on my right over here, might talk about later in the discussion. And there's also been some work done on fat in the diet, and that's at an earlier stage of preparation, but it looks like the amount of fat in the rice is sufficient to allow the bioconversion to continue at about the same efficiency, even without added fat in the diet. So about 40 grams, from the data we have at the moment, about 40 grams per day of golden rice with about 6 micrograms per gram of beta-carotene can provide about 40% of the estimated average requirement of vitamin A to a human, especially a small child. And that is, we are told, sufficient to combat morbidity and mortality from vitamin A deficiency. How much is 40 grams a day? Well, it's that much. That's 40 grams. It's not much. So we're very pleased about that. The next thing we need to do is continue this work of breeding into locally adapted and preferred rice varieties in all the countries where vitamin A deficiency is a problem and where the population has as a staple food rice. And this is a number of countries, as Peter's mentioned. And one of the big countries where this has been going on, with 3 different institutes involved, is in India. And I must say that the rice breeders have been very patient there, because they, starting back in 2003, have worked through several versions of golden rice which have been discarded as we moved on to the better one. And version 4 is the one that we're all concentrating on now. They've had that since 2006 in an American variety of rice to start integrating into Indian varieties of rice, and just since the end of last year from IFPRI and a couple of Asian mega varieties of rice for the breeding work. And I'd like to emphasize that although this is a genetic modified crop, a lot of people don't really know what's involved in that genetic modification or genetic engineering term. It doesn't happen all the time. Once, in this particular sort of rice, once, about 8 years ago, a gene was inserted. Ever since then, the multiplication of the rice has been through conventional breeding. So it's been about multiplying the rice seed, breeding the trait into Asian varieties, because the trait initially was in American varieties of rice, and then selecting the best materials for further breeding into local rice varieties. And here's some of the team, golden rice team in Vietnam, just to show that we're in a number of countries, and facilities in India, and here is golden rice introgressed into a locally important variety of rice, Swana, on the right-hand side of the picture. More recently, they're doing some other crosses into other varieties of rice in India. This is in Tamil Nadu Agricultural University. This is the just before planting of materials that arrived from IFPRI towards the end of last year, and they were planted in February this year. But what is the sort of future of the rice breeding program in India? Well, it's already, the golden rice trait is already in the high-yielding, good-quality Indian rice varieties. Field trials are planned there in 2012. And golden rice is currently being introgressed with additional agronomic traits into those good varieties of rice, including the submergence tolerance that has come out of IFPRI, I think, and also rice with bacterial blight resistance. We need always to have these biofortified traits in crops which are very acceptable to farmers, because we need to appeal to the farmers. If the farmers can't get a decent yield, they won't grow it, however good it is for the population to consume. And they're also planning to combine the golden rice trait with varieties of rice which are relatively high in iron, because iron deficiency is also a problem, as you will see later on. The next thing we need to do is to do marketing research to understand the people's interests in biofortified crops and the attitudes and their sources of influence, what it is, who do they believe for information about a new crop such as golden rice. Of course, new food crops have been moving around the world for a long time, about 5,000 years since wheat from Mesopotamia. Now Iraq was moved originally out of Mesopotamia, and more recently, kiwi fruits from I think from China and then from New Zealand are now all over the place. So there's nothing new about new crops, but in the case of rice, it's almost a religion. It feeds half the world's population every day, gives them most of their carbohydrate, and it's normally pure white, and most countries like and are very used to the white rice. So what are the things we have to do is to create demand both for the growers and the consumers, and to do that we have to modify their behavior somehow by influencing them and educating them and helping them to understand the benefits of growing this sort of rice and consuming it. And to do that, there are lots of techniques of doing it, but one of the techniques is to just go out and talk to people in a structured way to find out what their attitudes are to farming, what their attitudes are to nutrition, to who makes the decisions about what they eat in the household, and formulate views. And in the sort of focus group arena, you basically probe for attitudes, gradually giving more information, and then finally ask what they think about what it is you have to offer. In this case, this is actually a different petri dish of golden rice than the one I've got in my pocket, but it's the same, similar idea. The other thing we have to do is to continue economic analysis to support the policy adoption of golden rice as an additional health intervention. This is an analysis done by Stein et al. Some time ago, where they compare the costs of saving a daily. This is an economist term for a disability-adjusted life year. And the World Health Organization values a daily as being worth between about $600 and $1,900. And here's some figures for high and low efficiency of different interventions to try to combat that. And the highest efficiency use of golden rice looks very cost effective, as it would be for other biofortified crops, by the way, because most of the costs for a biofortified crop, when the crop is out there, this rice will be made available for the same cost as other rices. It doesn't cost any more to grow. There's no license fees or anything like that. So if you've paid all the development costs, once it's with the farmers, they can grow it and the consumers can consume it, and that's why the cost is so low. And probably, maybe it's even lower than that with new data that we've got. Now, looking at hidden hunger, micronutrient malnutrition in India, it might be a good idea just to have a look at some statistics here that Dr. Rao pulled together. 35% of the developing world's malnourished children are in the population of India. Now, it is a big population, about 1.3 billion, so you'd expect them to have some problems, but we often hear about the economic progress of the new BRICS countries, including India, but that economic progress is not uniform, and it's really in the urban and more anyway, there's a lot of poverty there. Vitamin A deficiency, they have the largest number of vitamin A deficient children in the world, and only about 43% of the children before the age of 60 months receive the recommended 2 doses of vitamin A a year. 75% of children and 51% of women are iron deficient, and that's a problem for mental development, of course, early in life, which can never be recovered even if you then supplement the diet with more iron. Iodine deficiency, you have to fortify, there's no way to get it from the diet, but only 50% of households can get hold of sufficiently iodized salt. And zinc deficiency is also a very significant problem. And in terms of the effects of these deficiencies, something like 300,000 child deaths every year, 6.6 million children born mentally impaired. Iodine also affects intellectual capacity. 15% of the population is affected like that. And anemia, apart from the mental impairment, some women die. A couple of 22,000 people, mostly pregnant women, die of anemia. And there's a lot of spina bifida and neural tube defects as a result of folic acid deficiency. So these are really significant problems in India. How do we make biofortified foods available to the Indian population? We also need to consider other things, and particularly in the area of golden rice, the opponents of the technology have been very effective with their messages, and the received wisdom is usually that there's something hugely suspicious about genetic modification, and the Indian public have picked that up as well, and they need to be reassured about the environmental and the food safety aspects of the technology and the product in particular. So there's a lot of regulatory aspects about genetically engineered crops which we believe are not scientifically justified, but which we have to fulfill. We have to follow those regulations, and they're quite onerous. And there's a whole debate that another talk or two, for an hour or two, we could talk about that and compare with conventionally bred crops, but this isn't the place. We also need to figure out how to multiply and distribute the new seed to get to the right places in the population as efficiently as possible, and that probably needs to include the public sector as well as the private sector. And we need to create this enabling environment through bringing together the different partners in that complex map of the organizational structure of India that I showed you, as well as other players and stakeholders in the system. And then get into social marketing to tell people about the product. Incidentally, a World Bank economist, Kim Anderson, seconded from the University of Adelaide a number of years ago, made a calculation that if golden rice was conservatively adopted in Asia, because of increases in productivity, it should add $15 billion a year to Asian GDP. So the strategy for India is really for the whole gamut of supporting the whole gamut of activities for conventionally bred and genetically modified crops, biofortified crops, from seed to spoon, as Dr. Rao calls it. And that's including breeding objectives for these major micronutrient deficiencies, iron, zinc, and provitamin A, going through and screening the natural germplasm of crops which are out there, looking for ones that are strong and high in these particular micronutrients, and breeding to increase the concentration of the micronutrients, and when they're not present, maybe where it's not possible to breed, to use the genetic modification technology or the products of that, as in golden rice. Then they are working on micronutrient retention and bioavailability studies, looking at the biological impact, and moving all right the way down to delivery systems to make sure that the technology gets to the people, to benefit the people it's designed for. This announcement that came out last night is great news. We welcome Helen Keller International to the Golden Rice Project in the Philippines and Bangladesh, as we move forward to trying to show that golden rice can be a very useful additional intervention for VAD alleviation. I think their practical experience and engagement on the ground, as well as their practical and very long-standing commitment to helping people with sight problems in particular, and health in general, it will be very, very good for the project. We're also delighted with the new funding for golden rice's project development in the Philippines and Bangladesh from the Bill and Melinda Gates Foundation. Thank you very much, Bill and Melinda Gates and Warren Buffett. And the regulatory data generated will be made available free of charge also to the golden rice projects in other countries, which will be very helpful to them. I'd like to acknowledge all the sponsors for the project. We haven't got all these sponsors at once, by the way, but there have been many sponsors, national programs as well as philanthropy, as well as companies helping the project at various times over the last couple of decades or so.